Lesser cases of COVID were detected in the children last year. However, this is not the case today. In the second wave of COVID-19, many children have tested positive for the infection. As innocent minds are unaware of the seriousness of the situation, their guardians must be more conscious and aware of the details regarding COVID in children. We at Medicircle are conducting a series on COVID in children through which we aim to raise awareness about the impact of COVID-19 in our little ones. Hello, I'm Sana Khan, and today our guest for the talk is Dr. Bharath Reddy. Dr. Bharath is a pediatric pulmonologist associated with Shishuka Children's Hospital, Cloud9 Kids Hospital, and Indira Gandhi Institute of Child Health in Bangalore. He completed his fellowship in pediatric pulmonology and sleep from the National University Hospital, Singapore. His key areas of work include respiratory infections, respiratory allergies, asthma, pediatric sleep, ventilation, and congenital respiratory disorders. Apart from being a highly trained pulmonologist, Dr. Bharath has presented over 20 scientific presentations at national and international conferences and written various book chapters and original manuscripts. He also has various awards to his credit. Please welcome Dr. Bharath to Medicircle. Hello, Dr. Bharath, how are you?
Yeah, hi, Sana. Hi. Great to hear from you.
Great. Okay, Dr. Bharath, we are witnessing a lot of children getting infected by COVID-19 virus, which was not the case last year. What do you think are the reasons for the rise in infection in children this year?
So there are various reasons, and the answer to this is multifold. So one of the first reasons why we found COVID higher in children this time was because kids were obviously let out to play. If you see in the last lockdown, I don't think kids came in contact with other children, did not come in contact with other adults as much. So we found that just before this wave happened, a lot of us let our guard down. Our children were allowed to play with other children, go out into the apartments. And I think that high level of interaction which was happening, some schools and colleges opened as well. This high level of interaction did result in many of them coming in contact with the virus, which they didn't in the first wave. The second thing is we need to understand that this is a variant. So this variant virus, we are seeing that it could be a peculiar behavior of the virus itself, where it is beginning to affect children more than what it did in the first wave. So two reasons. One is the interaction of children has gone higher, as well as the fact that the virus itself is a variant virus. But what we need to understand is, yes, even though children are getting affected in high numbers in this wave, fortunately, many are doing well. We don't see high amount of mortality in children, and many of them can be managed at home itself. So these are the reasons why the high numbers are there. But we are also worried that as this progresses, the pandemic, as adults start getting more and more vaccinated, children again can get affected as well. So which means that as we go into the third wave of the pandemic, which we should anticipate and we should be prepared for, more number of children can get affected in the third wave because more adults will start getting vaccinated. So even the current data, if you see, a large number of the positive cases are people who are below the age of 50, and a huge number, nearly 10 to 12%, are children below the age of 18 years, which means that as we start vaccinating the above 18 population, in the third wave, more and more children can get affected because they are going to be the vulnerable population.
So, Dr. Bharath, children are innocent minds, and it is difficult to make them understand about this pandemic, the precautions, etc. So, what would you advise their parents to deal with their kids in this pandemic time? Like, इतना मुश्किल है उनसे बात करना, उनको समझाना कि घर में रहना है, this is so important, and all the consequences that they're going to face. So how should a parent deal with children in this situation? Because we have to lock them down in the house, what you just mentioned.
Yeah. So it is a difficult situation, not only for parents, but also for children. So firstly, we need to understand that it is also difficult for children, right? And it is more difficult for them to be contained within those four walls compared to adults like us, right? So a lot of children feel very lonely, isolated, scared. I see a lot of children who are coming in with just panic attacks and anxiety as well. Heavy breathing. For example, I see children who come with just heavy breathing, and when we examine them, they're just panic attacks. So a lot of children are getting anxious. So the first most important step, why are children getting anxious? They're getting anxious because parents are anxious. right? And because parents themselves are living in fear, we as adults are living in fear, and that is transmitting to our children. So first important thing is we should not transmit our anxiety.
Correct.
Yes, we are hearing about deaths in the family, we are hearing about people getting sick, and we are getting anxious, but we should not transmit that to our children. I remember one mom told me, like, one of her relatives passed away, but she had to go into the bathroom, lock herself up, and cry, and then come out, and then she did not show that in front of her children, right? And so that's first important thing as parents is, even though you are living in fear, even though you are scared about a lot of things, ensure that you don't transmit your anxiety to the child. A lot of mothers are transmitting their anxiety to children, which I think we should not do. The second thing is media exposure. Of course, we are living in fear because of the amount of media exposure that we
True,
have.
very true.
We see
Yes.
seeing the news every single day about,
Right.
you see cremation pyres, and you see bodies piling up, and these are things that media is showing. We should not
Yes.
show this to our children. We should ensure that they're protected from this media overload, and especially in teenagers, because teenagers are going to be exposed to social media as well. So a lot of the social media out there is about deaths and the virus. So try to protect them from seeing a lot of this media pictures and images, because as you know how media can dramatize a lot of things as
True,
well.
very true. That's
And
right.
yeah, and third thing is a lot of calls. For example, I see a lot of patients who are getting parents are getting COVID, children are, we're not sure whether they're COVID positive or not. Parents are wondering, how do I separate children, right? So that becomes a lot of problem as well, causing a lot of psychological trauma in the child. Will I have to stay away from my parent? So currently a lot of us recommend that the child most likely is exposed. If you are positive, it is high possibility the child has already been exposed. So there is a little need for us to separate the children from yourself, especially small babies, like 1 year, 2 years, 3 years. They're highly exposed for sure already. So there is no need for you to panic and separate them from you, which causes more of a problem. And few tips I would tell parents especially is, one is tell your children about masks. I think a lot of parents underestimate how much children follow these instructions. To be honest, in the clinic, children follow more mask protocols than the adults who walk in. Children are more careful about wearing the mask and putting their mask on when they're walking into the hospital than adults. And today's children, because they've lived in this pandemic for 1 year, most of our children already understand what it is to wear a mask, why they should wear a mask. So all you need to do is tell your children about these basic protocols, right? My daughter is more particular about using the hand sanitizer than any of us are. So the moment we walk in, she's like, use the sanitizer first, right? So I think children understand that better. So we need to talk to them about that.
Very
Second tip I tell you, a lot of parents, is to ensure that the schedule is maintained. What has happened with this whole pandemic is a lot of our schedules have gone for a toss, right? A lot of our activities have gone for a toss. Routines are not maintained. So parents need to maintain a routine. The moment we maintain a routine for a child, right from the time they wake up to the time they sleep, has to be fixed. All this is maintained. Kids tend to have a, something to keep doing as a routine in the day, and they don't think about different things. It is when you don't have a routine or a schedule that kids get very anxious or get very upset.
correct.
So
Yes.
maintain a routine and a schedule. And the last tip I give to parents is, listen to your kids. If they are worried about something, talk to them about it. There's nothing to also say, no, there's nothing, just forget about it, don't talk about it, don't talk about the pandemic. No, if they want to talk to you about it, especially teenagers, it's important for us to listen and to talk to them and explain to them. So I think talking also is very important, and ensure
True.
that you spend a lot of quality time. I'm sure many of us spending time at home should look at it as a boon, and look at it as a positive aspect, that we're getting to spend so much time with our children finally, right? So spend good positive time, do activities, play games, play Antakshri like how we used to do in olden times,
Correct.
and enjoy that time as well.
Correct. And this is the time when we need to emotionally support each other, and especially when
Yeah,
we are with our kids, they need our support emotionally more than physical. So I think people need
exactly.
to understand, parents need to understand that emotional support is very, very important to each one of us at this time. So,
Agreed.
Dr.
Totally
Bharat,
agree.
how is your experience treating these COVID children? How has it been?
So definitely I'm seeing a large number of cases. Also being a pediatric pulmonologist, a lot of referrals come to me because COVID is known to affect the lung. So a lot of doctors are also worried that the kids that they're referring could have lung affection of the COVID as well. So I am seeing a
Correct.
lot of patients. Fortunately, a large number, almost 80 to 90% of them are managed at home itself. We are able
Okay.
to do a lot of teleconsultations and manage them at home. We do have a large number of admissions as well. So I am admitting patients with COVID, but what has happened is many of them present mainly with diarrhea, vomiting, high-grade fever. Okay, so the most common symptoms that I am seeing are fever and gastroenteritis. Many of them present also with urticarial rashes. Those are just rashes with a lot of itching. Children presenting with
Is
lung
this a
features are
symptom of
relatively very,
COVID?
very less.
These rashes, are
Yeah,
they a
they're all
symptom?
symptoms of COVID itself.
Okay, okay.
Yeah, so they are a symptom of COVID as well. And it can also be a symptom of what we call as MISC, which is also a later manifestation of COVID in children. Okay, so we need to understand that we are seeing a lot of children who are presenting mainly with diarrhea, vomiting, rashes. So the general presumption that we're going to see lung features is not there much in children. So we're not
Okay.
seeing much of them presenting with cough or difficulty in breathing. We are seeing them,
Right.
but much, much lesser, requiring oxygen. So why do these kids require admission? Of course, the first wave, I did not admit that many children at all. We admitted very rarely. This way, we're admitting a lot of children because they're getting highly dehydrated by just vomiting. They're vomiting so much and having so much loose motion that they're getting dehydrated. So when we give them good IV fluids and supportive treatment, many of them are recovering within a day or two. So that is a good sign as well. The number of children requiring oxygen are very, very few. So let's hope it stays that way.
Thank you so much, Dr. Bharath, for your valuable time and insights with our viewers today. It has been a pleasure having you on the show.
Yeah.